Sawadika, very good evening and welcome to Thai PBS World Tonight. I'm Nabunag.
I'm Tulip Next on Pop Lao.
And Thailand recorded 34 new COVID 19 deaths today, and this is the highest number since the pandemic began. Because if we look at a couple of days ago, we're only seeing like 21, 22, and the highest we've seen so far was only 31. And we're seeing 34 for today, and this raises the death toll to 486. At the same time, 1,983 new COVID 19 infections are also recorded. Most of them are severe cases, including around 400 people on ventilators. And this raises the total since April to around 60,000 already, while the cumulative total since last year is now almost 89,000. And if we look at the infection graph between Bangkok and its nearby provinces, and for the rest of the country, the CCSA assistant spokesperson Dr. Apismai Rangsan said during the press briefing that the COVID 19 infection graph for Bangkok continues to rise, while the graph for the entire country has sort of leveled out and may start to fall. So we're seeing that the infections in Bangkok as well as nearby provinces are increasing, and it seems like it is not going to decrease anytime soon. And she also even said that the severe cases are still the cause for serious concern, as more of them are having to be put on ventilators. And Dr. Apisamai also said that those who are infected and are admitted to hospitals sooner stand a greater chance of survival. Altogether, around 29,000 people are still being treated in hospitals. Most of them are in general hospitals, and there are still a group of people in field hospitals as well. And as we previously reported, Bangkok has already set up 14 vaccination sites to help the mass inoculation effort. And one of them that has started the inoculation is Central Lampang Shopping Mall, which has started the first day of the inoculation. And most importantly, the Prime Minister, General Prayut Chan-o-cha, has also observed the vaccination process as well.
Now, today, among the new cases, the news that actually share widely in the social media is the news about the women volleyball team, that the members of that team, actually 22 members of that team infected with COVID-19 plus another 4 trainers. And the 22 players and team staff of the overall 37 team members tested positive today. The testing of them of the team follow confirmed cases of 4 sports scientists who were working closely with the team to prepare for taking part in the Volleyball Nations League hosted by Italy between May 25th and June 19th. So all 26 patients, team members, and also the sports scientists have been admitted to hospital with none in a severe condition. The team will no longer be able to join the league in Italy, according to the association statement. The statement said that the association would like to apologize to Thai volleyball fans for the incident, and they will take the best care of the team like family. The team was practicing in Nakhon Pathom province for the games. The 4 sports scientists were admitted to Nakhon Pathom Hospital, while the infected team members are being sent to Bangkok's Piavet Hospital. The International Volleyball Federation's Volleyball Nations League replaced the World Grand Prix for international women's volleyball tournaments in 2017 and comprises 16 national teams. So there goes, it's like Olympics in Tokyo as well. If anyone got infected, they have to be out of the competition. And of course, their health is the most important thing, so they have to get treatment first.
Definitely. And now let's move on to another issue. As we all mentioned, that apart from the cramped communities that are hotspots of COVID 19 infections, for the previous outbreak, including this outbreak, it also includes fresh markets. And recently, Si Mummyeong Market, which is Thailand's largest wholesale vegetable market in Lamluka district of Pathum Thani province, was partially closed for 3 days after some workers there were found to be infected with COVID 19. So, according to an announcement by the management of the Si Mum Mueang market, only the zones for processed and imported vegetables are closed and they will reopen for normal business this Saturday. Health officials from Lamluka district have been conducting active screening yesterday and today, targeting more than 10,000 vendors and workers in the market. Screening is being undertaken at the Old Fruit Market from 8 a.m. until 4 p.m. in the afternoon, and another round from 7 p.m. until 3 a.m. The management said that those found to be infected have been admitted to hospitals for treatment, and others considered as being at high risk have been placed in quarantine for 14 days. The management also said that the vendors in the closed zones will not be charged rental fees during the 3 day closure, but all of them must be screened to make sure they are free from the disease before being allowed to return to the market. So that is what the management has done to curb the spread of COVID-19 in Pathum Thani province.
And now let's talk about the different part of the story, the part where people already passed away and there's a certain way to take care of the body. Of course, most Thai people will do the cremation. And because of the disease, they have to do the cremation. And there are some temples that offer free service for this. But this became a news when an abbot at Bang Muang Temple in Nonthaburi province told the reporters that there are some, they call themselves foundation, that pick up the body and try to get some money from the families of the victims of the fatalities. The abbot of the Bang Muang Temple in Nonthaburi offer free cremation services for the COVID-19 fatalities. And according to the monk, the abbot, พระสมุบุญเกิดฐานุตโร the temple learned from the family of COVID-19 victim that the body that was sent to the temple last week by such a foundation, that they were asked for 28,000 baht for the service without the temple's knowledge. Another foundation which brought a COVID-19 fatality in on Sunday was found to have asked for 18,000 baht from the family. The abbot is urging families of the dead to contact the temple directly to prevent foundations from engaging in such acts. He also urged the foundations to stop doing it, adding that there are no fees for the cremation. And he said he cannot reveal the name of these foundations because he doesn't want to have any conflicts. But here, let's take a listen to him a little bit.
อันนี้หลวงพ่อปรามให้หยุดกระทำนะเราช่วยก็ช่วยกันให้จริง
ซึ่งทางวัดเรานี่คือ
ช่วย
ไม่
กันให้จริง
มีค่าใช้
ทาง
จ่าย
วัดเรานี่ไม่มีค่าใช้จ่ายญาติโยมเขาช่วยเราอยู่แล้ววัดน่ะเป็นของญาติโยมหลวงพ่อกำชับพระกำชับเราอย่าให้นะลูกน้องเราช่วยกันอย่าให้ได้ยินข่าวนะว่าหลวงพ่อไปขอนู่นขอนี่เขาไม่เอาเพราะนิสัยหลวงพ่อเลยตั้งแต่เกิดมาเป็นมนุษย์จนมาถึงทุกวันเนี่ยจนมาบวชจนมาอะไรเนี่ยหลวงพ่อไม่เคยขอใครมีจะช่วยก็ช่วยมีจะให้ก็ให้ช่วยกันเถอะบ้านเมืองกำลังเกิดความวุ่นวายไม่ใช่จะมาเอารัดเอาเปรียบฉวยโอกาส
So yeah, they are opportunists, and hopefully they will, see this news and realize that they should be helping others in the society as well. Because some family they just couldn't afford to pay that much money, 28,000 or 18,000.
And around 28,000, that can be one person's monthly salary here, and
That's
that is a
true.
lot. So that is why the abbot has to come out and say, if you're going to come and do the cremation service, we do them for free, and please do not do it through the foundations, because to keep it simple, some of these foundations take advantage of others during this
Right.
pandemic, so it's better to contact the temple directly. And now let's move on to another issue, still about COVID-19 vaccines. Recently, the Public Health Minister Anutin Charnvirakul approved the walk-in COVID-19 vaccination facilities in all provinces, hoping to inoculate at least 70% of the population in each of the provinces. The approval came as the government's COVID-19 Vaccination Management Committee convened for the second time this year. The arrangement of walk-in facilities is to be managed by each provincial authority and will be one of the options for people seeking inoculation. The other channels are through the Mall-Prom application or the Line official account and group appointments for each agency. So let's have a listen to what he had to say.
รูปแบบแรกก็คือโหลดนัดเข้ามาตามแอปพลิเคชันหมอพร้อมหรือแอปพลิเคชันใดๆก็ตามที่รัฐบาลจัดมาเพิ่มเพื่อให้เกิดความสะดวกสบายกับพี่น้องประชาชนสองการนำเข้ามาเป็นกลุ่มก้อนเช่นพี่น้องอสม.หรือองค์กรนะครับทั้งภาครัฐภาคเอกชนสามก็คือเรื่องของการบุกรุกก็คือ walk in ซึ่งทางกรมควบคุมโรคก็ได้รับทราบนโยบายหลักนี้ของรัฐบาลนะครับอย่างเรียบร้อยแล้วเราก็จะได้เร่งไปดำเนินการจัดทำให้การให้บริการการฉีดวัคซีนแก่พี่น้องประชาชนเป็นไปด้วยความมีประสิทธิภาพสูงสุดนะครับ
So yes, interesting. After we have been talking about this, and finally government realized that there is something more they have to do, so that right now allow the walk-in facilities set by each provinces themselves.
It's really interesting so that it adds more convenience to other people as well. At the same time, the Director General of the Disease Control Department, Dr. Opat Gawinpong, said that the new channel will help those without smartphones to register for the inoculation to access the program. However, he still urged people to register for vaccination through the Lampang app so that follow-ups related to side effects can be made for second dose appointments as well as for vaccination certification. He explained that the inoculations will not be limited to high-risk areas, but will cover all areas where each province will have to take responsibility. Dr. Opat also urged people not to worry, as he assured that all vaccine brands are safe, adding that doctors will determine which vaccine is safe for each person, and all inoculations are done under the doctor's supervision. At the meeting today, the plan to procure 50 million more doses of vaccine next year was also approved, paving the way for Thailand to inoculate its entire population with a total of 150 million doses. At the same time, 100 million doses are set to be procured this year. The committee will also discuss with vaccine producers the allocation of vaccines that will curb possible mutations of the virus and get everyone inoculated with the first dose as soon as possible. But so far, out of 2 million doses administered, he said that there have not been any reports of deaths or disabilities from the vaccine.
So right now the problem we have is the hesitance of the people that if they're eligible for the vaccine, but they're not sure whether they want to take it because they're afraid of the side effects, to say the least. And this seems to be the problem of the whole country, except for one province. We are talking about Lampang province. So Lampang province have over 220,000 residents that have booked the COVID-19 shots, filling the slots reserved for at-risk people. It might sound like not as much as Bangkok because Bangkok has over 500,000 people, but if you count in percentage, this is actually much higher in percentage than Bangkok. Lampang has a population of about 740,000 people. Of these, 190,000 are aged 60 plus and 22,000 have been diagnosed with chronic conditions, namely respiratory disease, heart, blood vessel conditions, chronic kidney failure, stroke, obesity, cancer, or diabetes. Bangkok, top nationwide, of course, but of all the provinces, only Bangkok and Lampang that record 6 digits of the people registered for the COVID-19 shots. So this suggests that public interest in receiving the vaccine is worryingly lukewarm. At a time when the country is racing to inoculate 70% of the population, which is 50 million people, to get to the herd immunity. But what Lampang did is very interesting. So now let's take a listen to the governor a little bit.
การในการเข้าถึงแอปเนี่ยมันอาจจะยากเราก็เลยเปิดช่องทางเคาะประตูบ้านเราส่งอสม.เข้าไปในทุกบ้านทุกชุมชนอสม.ของเราเนี่ย1คนดูแลประชากรประมาณ 60-70 รายถ้าคิดง่ายๆอสม.ของเรา1คนจะเคาะประตูบ้านประมาณ 15-25 หลังไม่เกินนั้นเวลาชาวบ้านที่เข้าใจเขาก็จะยินดีแต่ชาวบ้านที่ไม่เข้าใจเราจะเพิ่มเข้าไปนิดนึงก็คือว่า ต้องอธิบายให้เขาเข้าใจว่าไม่มีใครรู้หรอกอนาคตจะเป็นอย่างไรอีก2 เดือนข้างหน้าจะเป็นอย่างไร
So we can see that a health volunteer is a very crucial mechanism in this campaign. Lampang province have the health volunteer handle about 60 to 70 people, which is around 15 to 25 households, and knock on the doors to make sure that everyone knows that this is available. And according to the Chief Medical Officer of Lampang, Dr. Prasert Kitsuwanrat, the vaccine awareness push began a few months ago. Village health volunteers got inoculated, then they can boost locals' confidence in getting the shots. Meanwhile, foreseeing potential hiccups with the Public Health Ministry and more Prom online platforms, Lampang Hospital's IT team launched its own Lampang Prom, which is mean Lampang Ready, program as a backup. Lampang Prom was fully developed and linked to the More Prom by April, well before the government started accepting vaccination bookings. Lampang has also set up a call center with 10 lines to assist people who have problems booking a COVID-19 vaccine online. The call center operates from 8 a.m. to midnight. Officials from Lampang Hospital's dental, rehabilitation medicine, PR, and social medicine departments are helping out by answering phone calls about the vaccine and appointments. So you can see that the well-planned and cooperation from all sectors of the province is very, very important. And I think the governor did pretty good job that planned all this out. And he knows that health volunteers are the group of people that actually can really access to everyone, every single one in the area. So he utilized that part of the province, and the result come out pretty good.
Right. And now let's move on to something a little bit lighter, but it's still a big issue because it's all about food waste. Now we're introducing an app that has a big mission to tackle food waste in Thailand. Our reporter Stephanie Adair has more.
Every night, millions of tons of food are thrown into the trash, gone to waste, creating a carbon footprint, cutting short our lives on this planet. The UNEP Food Waste Index Report 2021 shows a total of 931 million tons of food is wasted each year. Nearly 570 million tons of this waste occurs at the household level. This is 200 baht worth of food Thai PBS World rescued through the Yindii mobile application, which sells surplus food from bakeries, local merchants, hotels, and supermarkets, and which is very safe, high quality, and hygienic, but just needs to be eaten before the end of the day. Louis, co-founder of the food rescue mission Yindii, is on his mission to tackle food waste in Thailand. He said the people are just beginning to get a grip on environmental impact of wasted food, and someone somewhere is losing money, while people elsewhere are starving.
We are producing 30% of our food that will never be eaten. 30% of our crops that could be burned because it will never arrive to someone's belly. And we thought it was just an economic impact, because someone somewhere is losing money. But it's also humanitarian because there are people that are starving, and this food could really be redistributed. And we just started to grasp the environmental impact of food waste. Because now we have in our mind,
despite being one of the world's most renowned food spots, Thailand's food waste problem is on the rise, with tons of good edible food being thrown out. Despite its quality, Yindii is currently the only food delivery application that saves food from being thrown out. So when it comes to food waste, you could say that this is a win-win-win situation for customers, the businesses, and the planet.
ฟีดแบ็กดีกับพนักงานนะครับกับทุกคนที่รู้สึกว่าทั้งตัวเชฟเองกับตัวผู้ขายเองเรารู้สึกว่าอาหารที่เราทำออกไปนะครับแทนที่เราจะไปทิ้งขยะเรามีโอกาสได้ส่งต่อให้คนอื่นได้มีโอกาสได้ชิมอาหารของเรานะครับโปรดักต์ของเราที่ทำออกไปครับดีขึ้นเรื่อยๆเพราะเหมือนกับลูกค้าก็รู้จักทางยินดีมากขึ้นแล้วก็ให้การตอบรับกับแอปพลิเคชันดีมากขึ้นครับยอดของเราก็เลยเริ่มเห็นคนที่ให้ความสำคัญในเรื่องของฟู้ดเวสต์ตรงนี้มากขึ้นแล้วก็ช่วยเราไปในการรักษาสิ่งแวดล้อมไปด้วยกัน
In 2016, France passed a law requiring retailers to not throw away leftover food, but instead to donate it, and if not followed through, there would be a fine up to 3,750 euros, or about 140,000 baht. Cooperating retailers can also use the food they donate as a tax deduction. While Thailand doesn't have such laws despite the effort of the private sector to find ways to donate food, Lewis says that Yindii will hopefully create a change from the bottom up.
The carbon footprint of food waste is extremely higher than what we thought. So if 1/3 of the food that we produce is never eaten, it means that 8 to 10% of the carbon footprint around the planet comes from food waste. To give you a comparison point, it's 4 times the airline industry. The law might be also need to change to protect supermarket when they give donation of extra food to association, NGO, enterprise, supermarket. They need to change also their way of selling the food. I think we have a lot to change. And the good part of Yindii is with starting from the bottom up. So we're giving people the power to decide what future they want.
Report by Stephanie Adair for Thai PBS World.
So Yindii application, I need to check it out. Seems very interesting.
Yeah, exactly, because there are so many options that you could choose from, and I do like their idea that they want to reduce the amount of food waste. So what they actually tried is that whatever you buy, you have to eat it today.
So imagine that, like the guys from Yindii said, that the food waste in amount, it's the footprint from food waste from household is 4 times bigger than the airline industry. That is a lot, a big amount. So this is something that at least we can do, just reduce our own food waste.
Exactly.
And that's all the news we have in this edition of Thai PBS World Tonight. But if you want to know more about anything that happened in Thailand or also in Myanmar, in ASEAN countries, anything about vaccines or any other things interesting, just go to our website, www.thaipbsworld.com, and we have YouTube, Twitter, Facebook, we have Instagram, and we have TikTok as well.
And that wraps up tonight's edition of Thai PBS World Tonight. Thanks for watching, stay safe, and we'll see you tomorrow. สวัสดีค่ะ
สวัสดีค่ะ